Assalamu alaikum everyone, and welcome to a new session of MAV Health and Wellness Committee. I hope everyone is doing fine, keeping positive and keeping safe. It's always good to be here to see you guys, and inshallah I hope this talk will benefit you as always. Today my guest is Dr. Tayyab Paracha. He was an active community member for the Muslim Association of Virginia, a very active member in Sunday school. He is my cousin as well. I'm so glad to have you, Dr. Tayyab. He's board certified in psychiatry and neurology. He's completed his psychiatric residency training at Charleston Area Medical Center and currently working with young adults and in partial hospitalization program at Northeast Spring Behavioral Medical Center in Leesburg, Virginia. He also has his private clinic in Loudoun County. And we're really glad to have you, Dr. Tayyab. We have a lot of questions. I'm sure Dr. Hina has a lot of questions for you because we both have teenagers, we both deal with kids. Sister Talibah is a teacher as well. So we have a lot of questions. Inshallah, I hope you can answer a few of them in this short time and we all can benefit from us. Dr. Hina, welcome you as well. It's been a while since we've seen you. Inshallah, I hope you have some good news regarding COVID, some guidelines. Since Eid is coming, what are we supposed to do and how we can stay safe and keep our adults and other community members safe. And Sister Talibah, I welcome you as well. Sister Talibah is our Vice President of Muslim Association of Virginia. She's my team member, a very good mentor for me. And inshallah, she will have some new announcements from our Social Welfare Committee from Darun Noor. And of course, regarding some about the Eid as well, like what's going on. Are we going to have an Eid prayer if the Eid prayer is inside or outside? I hope she will have some answers for us today. So Assalamu alaikum. I will start with Dr. Tayyab. Assalamu alaikum, Dr. Tayyab Paracha. I welcome you to my show. Thanks. I'm really glad you could take out some time and help us. Inshallah, you have kids, so I'm sure like your experience as a father will be even better and more because you have a little older kids and you deal with them, mashallah, really nice. So Dr. Tayyab, my first question today is like, what is the difference between a psychologist and a psychiatrist?
Okay, so first of all, assalamu alaikum to everyone. And I'm glad I'm here to help others. And I have been actively involved, as she informed you, with Sunday school in the past and still feel a part of community. So the question is about what is the difference between psychiatrist and the psychologist. So psychiatrist is basically a medical doctor who goes through a residency training for 4 years in psychiatry. And then if he decides to go for subspecialty, which can be any. And so it's basically the same as medical doctor, which people are in other fields. So they are doctor in the field of psychiatry and they can diagnose various mental health disorders. They can do therapy and they can prescribe the medications. So while psychologists, they can be bachelors or masters or PhD in psychology, and they can also diagnose, but they treat only by therapy. So it's basically talk therapy mostly. So the combination of the treatment works best for certain disorders, but for some disorder is only the medication, or some disorder can be treated only by therapy.
It's a good answer. I hope people understand because I get a lot of questions if they see a sign and symptom in their child. Most parents still are not clear that should they discuss it with their medical doctor or should they take him to a behavioral therapy facility, or should they, because when the word psychiatrist come, I think it's still a taboo. People think that the child might go on some drugs and then the drugs, I don't know if they can withdraw it from it or not. So there are a lot of commotions goes on with this. Yeah. So then my next question will be what are the indicators in a child? What are the indicators that the parents should be aware of if they're seeing their kids, like teenagers or any other, this is a time to see a doctor or psychiatrist before it gets too late. So what are those indicators in different?
Okay. So because we have different disorders in mental health. So for each disorder, if there's some alarming sign, and some are common for all the disorders, like irritability is the most a symptom which can occur in any disorder. It can occur in depression, anxiety, can occur in bipolar disorder. You may see it in schizophrenia or psychotic disorders. You may see it also in what we call, there's a new diagnosis came in 2014, which is called disruptive mood dysregulation disorder. So first I will start with the depression because this is the most, uh, area where we should focus more because of the recurrent suicidal thoughts. So, so persist anything first for any disorder, you need to understand that like there is a change in functioning. First thing you should look for any disorder, like if even if it is anxiety or anything. So you look at functioning of your kids if it is changing. And now functioning does not mean like only school. It should be functioning and taking care of their hygiene, interacting with others, involving in activities like games, sports, or the grades are dropping. So these are something which can occur in any disorder. So if some kids have milder form, so they may not need much help. But if somebody is not functioning well, you definitely need a help. Now, the signs for depression can be persistent feeling of sadness, which are not resolving, kids is staying isolated, getting irritable easily, um, not interested in the activities which he used to get enjoy, his change in pattern of sleep and appetite. And as I talked, like most alarming symptoms for the depression are like feeling of worthlessness, seeing no meaning of life, getting suicidal, or there's also kids, adolescents also exhibit this behavior, which we call like self injurious behavior or self harming behavior. They may cut themselves, they may pick on his skin, they may scratch themselves, even the burn, they may burn. So this is the most alarming symptom where you should definitely see a psychiatrist. And for suicidal ideation, it is actually indication is to take the kid to the ER and get admitted. For anxiety, persistent worries, kids are fearful. Kids are, they are thinking catastrophic, like worst outcome of any situation, getting panic attacks, and in the social situations, they feel uncomfortable and they avoid. If you tell them we are going for some speech or something, they may avoid that. Now, the psychotic, which is in simple meaning, it will be you're losing connection with the reality. So you may get paranoid, delusional, you may hear voices, see things. And this is the part where therapy does not help much. Psychotic kids get less help from the therapy because they are losing connection with the reality. They are not in a state where you can help with the therapy. You can help them once they are stable. Now, another disorder is OCD or obsessive compulsive disorder, which is preoccupied with the obsessions and compulsions, is a repetitive thoughts in your mind. And to overcome these thoughts, you go for compulsions. Like example will be if you have a fear of germs, you wash your hand repetitively that you may get rid of the germs. And you reinforce your behavior by that, like the germs are not coming to me because I'm washing hand, and you do it more and more. I talked about disruptive mood dysregulation disorder. Simple definition will be like the anger is um, beyond the trigger. Like trigger is a small, but the kid is responding by anger higher than what is the trigger is. And usually they stay angry all the time. Other disorder is ADHD. I think you have seen all the hyperactive kids. So one is hyperactivity. Other is like they are unable to concentrate. So grades or the like they are very easily distractible. If you ask them to sit, do the homework, like after 5 minutes, they will be gone. and you have to like redirect them. And they are very impulsive also sometimes, like they will make jump for the conclusion or decision, or if somebody's talking, they intrude in between very easily. And usually the ADHD diagnosis is done by two settings. Like it's not only the doctor will do, it's actually you ask the teachers too, and it's very noticeable. These are some common, I mean, like there are others too, but these are the top ones, I believe. I mean, if I'm missing any, you can ask.
I will let Dr. Hina ask like a few questions after me. Just for now, I have a question. Like, what is the difference between stress and anxiety? Are they of the same line? And because we use the word stress from our kids like regularly regarding their homework or their assignments,
Okay,
is that stress
okay.
like a bad
Is
stress as well?
okay.
This is the
Stress
question.
is
Yes.
stress is a situation. Anxiety is a feeling or emotion you're expressing. So stress can cause anger. Stress can cause anxiety. Stress can cause um, the depression too. So stress is what is a situation like, if how you respond to the situation, and based on the situation, your response can be anxiety, can be anger, can be depression. So anxiety is like excessively worrying, like uh, thing which may not worry me may worry you. Like okay, I have to drive, so I may not be worried. If somebody is very anxious driving, if I say you have to drive, so they will take the situation as and too anxious. And also, like things may make me angry, but may make you angry. So it also depends how the kids are grown, how sensitive they are to the things. Like it's just like if I give an example, like um, some people's skin is very sensitive, some people's skin is not that sensitive. So everybody respond different to the stress. People who have not dealt with the stress, or they are not taught like stress can come in life, they will be more sensitive. Like if overprotective moms, most probably, like some people are very overprotective for their kids, and they have not been exposed to a situation, and when the situation comes, it's still there's a like a stages of the life where kid have to separate from family, and when they go out, so they could not handle with the situation because we always protective them from the situation. So it's you have to teach them from when you're growing them, like okay, that there's failure can come in the life, stress can come in the life. If you don't teach them, they will not learn, and they will be dealing they will be expressing to the stresses like to the higher level as compared to people who have learned how to deal with the stress.
Really good answer. I hope it's beneficial to all like the people who are watching, and I hope like whenever somebody watches this video can benefit from this talk. So Dr. Tayyab, my next question will be like, once a child is diagnosed with ADHD or other disruptive mood disorders or anything, and a psychiatrist put them on medicines, is that a lifelong thing once the child is diagnosed, or those disorders go away with medicine and they're just, you know, a certain part of their life that they have to take the medicines?
Okay, so there's a one part is that natural course of the disease. Like when you start kid on medication, the it depends on what age you're starting. So kids are very immature. So when they grow up, their brain maturity is coming. So that brain maturity compensates for some disorders. Like if I ask a kid at 5 years something not to do, he may not understand, he may respond different, and a kid who's 8 years old may respond different after understanding what the question and what I'm asking. So for ADHD, they say like there's a if one third kids grow it out when they are in their teens, one third may continue their concentration problem, but their hyperactivity settles down, and one third continue all the disease. So it depends on what category they are falling, and they need to take the medication or not. But for ADHD, I have seen very few people go off medications. because they learn to live with the ADHD medications, and they are unable to function when the ADHD medications are taken out. So most of the kids stay, but I have seen very few, like few people have grown too. I mean, like they were able to get off medications. Now, disruptive mood dysregulation disorder, they can get off medication when they mature up. Now, sometime the kids, when they grow up, they may develop some other disorder. So the medication may continue, like if they are having some mood swings related to bipolar disorder or something, then they need to continue the medication. But actually for disruptive mood dysregulation by FDA, there is no proper medication. It's just like you give mood stabilizer off label to help them with their anger, but mainly is the therapy. So they need to learn how to, they need to learn how to deal with their anger and how to express it.
Okay. So really good explanations. Dr. Hina, at this point, do you have to add something? Do you want to ask any questions? Since you are a pediatrician and you're dealing with a lot of kids, would you want to add something?
Yes, thank you, Sister Asma. So, Dr. Paracha, in regards to the stress that you had mentioned, that stress is there and how we react to it, how certain people are sensitive, more sensitive than others. So, with this whole, this big stressor in all of our lives right now, where everyone's, at home
COVID-19.
and with COVID-19 and stuff. So,
Okay.
So just to, kind of give people the idea, at what point do people need to seek help or help for themselves or for their children? What part is like, okay, yes, everyone's a little bit anxious, and at what part do they need maybe therapy or medications if they're not dealing, with the situation?
Yeah, I mean, this is very difficult question in this sense because the fear is real.
Right.
So most the anxiety actually definition is actually the fear. You feel the fear is not actual there, but you feel the fear, or the fear is small.
Absolutely.
Like example is that, like if I say, like in a room, a snake is in, and I believe that, but I never open the door to find out the snake is there or not.
Right.
And so we encourage those patients, like open the door because there is no snake. But we cannot say that to the COVID patients because there's COVID is out.
Right.
So the main thing is like with all precautions, like, okay, you have to follow all precautions, wearing mask, not shaking hands, keeping the social distance. And with all measures, then you support them. If you are taking all the measures, the chance is less. And so you should not live a life in a fear which is not there, something not there.
Absolutely.
So that's, and now when you need to seek a help, I mean, like if patient anxiety is severe, they are having panic attacks, they could not deal with it, and they are unable to sleep. They are, all the time thinking about what do you call rumination. Like rumination definition is like you repetitively thinking about the same topic, just like a cows when they eat hay, they chew it, throw away, and then pick it again. So similar thing. So those are the, like I would say, like the symptoms where you should seek help for either with the therapist or with the psychiatrist. I mean, the medication will give you temporary relief until the situation resolves, and then you can take off the medication, because this is situational. So sometimes situational, the answer to one question which Sister Asma was asking, like when you can get off medication. So if depression, anxiety, if this isn't due to situation, so you give medication at that time to help them, and once the situation resolves, you can take off their medications.
Absolutely. Thank you. Yeah.
Oh, you're welcome. I hope I answered the question you asked.
Absolutely, because it does, pop up pretty often. Everyone's a little bit on the edge these days. So it's always a good idea to see when exactly, when things start becoming really dysfunctional, it's a good idea to reach out for help.
Yeah. Yeah, I mean, like basically is like when the functional is the main thing, which I was like for any psychiatric disorder,
Right.
when the like any mental health issues affecting your functioning, so you're unable to function, seek help.
Okay. All right.
Good advice. So Dr. Tayyab, before I let you go, this will be my last question. Like as parents, what can we do when our kids are younger, or like moms to be or fathers to be? Are there any guidelines or any steps that they can take so their kids do not end up being over stressed or over anxious, or like the problem like ADHD, or is not preventable? Like it's just like according to the situation, that these situations can arise with the kids, even though their parents were very sturdy and they were doing the right things.
Yeah,
Is there
I mean,
any
like
advice for the parents that
yeah.
you would want to give?
So the teaching them situation can come and situation resolve. So giving them some situation can come, and also giving them hope the situation will resolve. So, and the support, like parents need to be supportive. Parents, main thing is that when kids need parents, they need to be there. And even if kids are wrong, you need to listen to them. You acknowledge that that the kid is hurt, and then you give your feedback like, okay, this is what is this, and what you're going through, it will pass through, and there's a hope, and things come in the life and they pass away. And so that's the I would say like this thing. And second thing is like also keeping the boundaries. I mean, it does not mean you should not keep the boundaries, but you cannot put boundaries suddenly. You never put the boundaries when they were growing up, and now when they are teenage and you say like, I want to put boundaries, it will be hard job. So different strategies for different levels. Like if I'd say like if somebody is growing now and the kids are, I mean, you did not bring the topic which most struggle is with the electronics, and answer is still.
Because I think even psychiatrists cannot help in those,
Yes, I'm understanding. This is very difficult answer.
Yeah.
Actually, they put in when they started the new DSM-5, like we go the diagnostic manuals for us. So DSM-5, I believe, came in 2014, and they put like internet addiction, but it was rejected as a diagnosis. So someday it will come as addiction. So once it falls into addiction category, then you will say like this is a problem, but I see it as a problem, especially with kids not sleeping at night. Mm-hmm. So they are with their electronics. Like, I don't know, or not, like my kids under 18, they're all cell phones and electronics are charged in my bedroom.
Same here.
we tried, like even for the parents, we try not to take our electronics in our room. So this is the rule, like even for my husband.
Yeah.
Just leave your laptop and
yeah, I agree.
As much as you can.
Yeah, this is the most hardest job. Maybe I'm not doing too, but like what we call not the modeling, walking on the ramp, but modeling definition by psych is that like what you're teaching your kids, you have to do. Absolutely. You cannot say like in like Pakistani culture, you cannot say, tell on the phone, like I'm not at home. And then, or say outside bell is ringing, like the parents are not home, and then teach them, don't lie. Mm-hmm. You cannot do that. Yeah. So parents needs to model for everything.
Yep.
Okay.
It was very helpful, Dr. Tayyab. Thank you so much for your time. Thank you so much for all your advice. And I hope to have you in my future programs as well. Everyone, if you are watching, you can ask a question at health-wellness@darulnoor.org. You can leave a comment in the comment box. And inshallah, I will try to get hold of Dr. Tayyab, get all the answers and answer your inputs or whatever, inshallah. So then, thank you so much, Dr. Tayyab.
Thank you.
Next, I will have Dr. Hina again. Welcome, Dr. Hina. Please give us some good news regarding COVID, if there is any, because I have seen since we are in the phase 3 of the lockdown, it looks like outside there is no lockdown. People are like not following guidelines.
Right.
I'm like mingling here and there everywhere actually. So I'm really scared, like other states, we will have to rebound and go in the lockdown again. So please give us some First of all, of course, some good news regarding COVID. If the numbers are like getting low, if we have plateaued the curve and all that, and some guidelines like how to be safe as a community, as a country, inshallah. And since Eid is approaching as well, I'm sure we will do many parties and all that.
Yeah, absolutely. Thank you, Sister Asma. So starting off with some of the numbers, and which are looking a little bit better. So as of this morning in Virginia, the whole state of Virginia, we had a little over 800 new cases, and unfortunately 9 deaths. But in Prince William County itself, we had 44 new cases and no new deaths, alhamdulillah. So what we've been seeing is that the cases have been plateauing, and the positivity rate that we had mentioned earlier as well, so that is declining. So what is the positivity rate? It is, out of all the people who've tested, how many were actually positive for the disease? So it's at its lowest, at 8.9%. It started trending down since June. There are 2 causes for it. One is what we hope is that there are less people who are getting sick. But one of the major causes is because a whole lot more people are getting tested now. So in April and May, pretty much it was all the symptomatic people who were ill that were getting tested. And now with, phase 3 and being, there are people who are traveling, who want to get tested prior to that, returning to work, if they've been exposed. So the actual number of people who actually have the disease is still plateauing, but we're testing more and more people, which is a good thing, which will give us a good idea of where we're going with this pandemic. So with in Prince William County, because of summer being in full swing, and what Sister Asma had mentioned, that we do see a lot of people still moving around. One of the highest number of cases is in the young population, the young adults, the ages 20 to 30. And we've seen them in quite a few teenagers as well. And the reason for that, the theory was that they have been, graduation parties and kids kind of hanging out together after, because school's done before they start college in fall, hopefully. That's why we're seeing an increasing number of cases in there. But overall, the cases are plateauing, which is good. We're kind of, we've reached the peak, and we're kind of going steady there, and hopefully we'll start trending down if we keep doing the right things. So what do we take from this? That yes, we're heading in the right direction, very slowly, but the main thing to remember about this pandemic is that this is not a sprint. It's not like 100-meter dash. You start, you reach the end, and you're done, and you don't have to worry about it. It's actually a marathon, and this marathon has just started. So we're right at the beginning of it. So we need a lot of perseverance. We need to keep up with our efforts, because just because we see things are getting better doesn't mean we kind of let go of everything, because just like some of the other states, we're going to go right back to square one. Things are going to get shut down again. There's going to be increasing number of cases, and we're going to be in back to phase 1 or lockdown, or however it is that needs to be done. So we don't want to go back there, because then we'll have to start afresh. So what we need to do, especially with, yes, Eid's coming up, but more than Eid, we have to think about it as a lifestyle change. And we as humans are pretty resilient creatures. We can do well. I know some of us have a little bit of difficulty adjusting to change, but we can all make those little changes. We have to, make this as part of our life, so that we can progress without getting backtracking too much. So what do we need to do? We must still remain cautious. We still have to wear masks when we're out in public, when you're going to the grocery store, when you're going to Home Depot, any other place. If you are meeting a friend, please wear a mask. Please stay 6 feet apart. Please keep on having that social or physical distancing that we call it. have your good hand hygiene. Kind of be mindful of things. You don't have to kind of wash your hands every 2 minutes if you've been at home, but if you've been out and about, just be mindful of it, that you're washing your hands prior to, touching your nose and face. And then, especially with Eid coming up, please, I know we're in phase 3. I know the rules are laxed, but the best thing still right now is to be cautious. Don't have super big parties. If you're inside with a whole bunch of people with poor ventilation, everyone's there for 3 hours. We just need that one person to spread it around, because the virus is going to linger on surfaces. It's going to linger in the air. Everyone's kind of right around there in close proximity to each other. So if you do want to have an Eid party or meet up with friends, because I know everyone's tired of sitting at home, they want to meet people, the best thing to do is to have like smaller gatherings, maybe 1 or 2 families. Make sure everyone is doing well. They haven't traveled to some of the other states, which may have a high case count. Nobody's sick. Everyone wears masks. You meet outside. Keep your distancing as much as you can, and still try to enjoy life along with it. So like I was saying earlier on, it's we're doing good. We have to keep up with all our good efforts. Northern Virginia is doing better than the rest of Virginia. So, we have to keep up with the efforts. We have to make sure that those numbers are trending down. It's our responsibility, not only for ourselves and our families and friends, but yes, for our community and really for the whole mankind. I mean, if we don't take responsibility of it, things are not going to improve till we all make that effort. But like I said, humans are great. We've got this. We can do this. Just keep chugging along. Remember, it's a marathon. We've just started, but build up your stamina and keep going. Thank you.
Thank you so much, Hina. So people, please follow the guidelines. Of course, maintain your distance of 6 feet. Keep washing hands. Stay safe for a community, for the state, and of course for the mankind, as Dr. Hina said. So now I will have Sister Talibah Hassan, and she always is she's my mentor. It's always a pleasure, Sister Talibah, to have you. She will have some announcements from the Social Welfare Committee of Darun Noor, and also I hope she has some announcements regarding the Eid prayer that is coming up end of the month, inshallah. So Sister Talibah, assalamu alaikum.
Wa alaikum salam. Peace to all my brothers and sisters. Assalamu alaikum. I do have some announcements today. I'm going to start with a countywide announcement. As you know, we do help with Zakat, and you can send in your applications or request an application if you need help with your utilities and your rent. And that's social welfare at darulnoor.org. If you go to our website, that information is there for you. Now, our county, Prince William County, has received $2 million to help with rent. And this is rent for those who are affected. Their jobs were affected by the COVID virus. Either you totally lost your job, or your hours got reduced, or you were furloughed and you're just getting back and you need to pay your rent. So go to a Prince William County government website, and there they will have a page for you to click on for housing. And there's a form. They'll first ask you, you will have to register, which means you sign in your name and you give yourself a password. All right. And then they'll send you an email that says you're registered. Then you go log back in. There are 4 steps. First one is, do you qualify for COVID? And it's this rent assistance. It's based on income. How many people in your house? One person, it's around $55,750. If you make that or less, then you qualify. And then it keeps going up. So you can go on that website and see this. You do a little checklist, only takes a few minutes, and at the bottom it'll tell you whether or not you qualify. If you qualify, then you continue on with the other 3 parts. So it's filling out the application, adding who's in your family, and then you do have to have some kind of verification. It could be unemployment checks. It could be a letter from your employer that you got furloughed. But go to the website. That money is available. If you're struggling, you need to check all avenues of help. We help, but while you're waiting, because it takes 3 to 4 weeks with us, we're not emergency. Everyone who works on the committee is a volunteer. So please use other avenues, additional avenues, because we know that you might need rent this month, but you might need it next month. So the more avenues you check, the better for you. This coming Friday, our prayers will be outside again, and 12:30, 1:30, 2:30. For those of you who are going to be staying at home, at 1:30, you can go to our website, www.darulnoor.org, and hit live stream. And you can hear, it comes across very clear and whatnot, the live stream of the 1:30 Juma prayer at Darul Noor. So that's something people who want to stay at home, if you have a compromised immune system or you don't want to be in the crowd, even though they're 6 feet apart. Now, when you come, those of you who come, you need to wear the mask. Not only do you need to wear the mask, you need to put it on properly. All right. We shouldn't see your nose. All right. So this is the proper way. Okay. And some little 5-year-old learned a little thing. ABC, put on mask. Okay. So you put your mask on. You need to bring your own prayer rug. All right. Bring your own prayer rug, because you are out in Allah's great blue open creation, and there are other creations out there with you. So bring your own prayer rug. You'll be sitting on the ground, so the prayer rug keeps you separate from the rest of Allah's creation while you're sitting. All right. Now, I have something for the Eid. Alhamdulillah, we are having Eid. Again, it's going to be outside. And at the moment, it seems like it's going to be enter cars and drive up. And they're going to be early prayers. We're going to start probably around 6:30. So we may be able to give you more details, but check the website as the details gel. But yes, we are having Eid prayers at the masjid, but not in the masjid. We're going to be again out in Allah's creation, alhamdulillah. You know, I just love these days, looking at the blue sky, the white clouds, the green grass, the green leaves on the trees. I love listening to the birds. All right. So alhamdulillah, we will be having Eid outside. Those details of how we're going to do it will be coming in the next week or so. Now, brothers and sisters, you've probably seen lots of the demonstrations and things in Washington, and it's caused Allah is causing change for justice. And Darul Noor, we're looking inside ourselves at Darul Noor. And this coming Sunday from 4 to 5, every Sunday, Imam Abdul Ahad has a virtual coffee tea. All right. And so this Sunday, at the virtual coffee tea, we have a new task force. It's called, so we're having a community town hall this coming Sunday from 4 o'clock to 5 o'clock. It's going to be on Zoom, and hopefully, inshallah, I've sent the flyer for the Friday announcements. Hopefully so Mirza, are you listening? Asan, are you listening? Please post the flyer so that it has the Zoom information for you to zoom in, and we'll also have it on Facebook Live, so you can, if you don't zoom in, then you can Facebook Live it. But we're going to be introducing the Muslim Association's new task force, and we're calling it the Anti-Racist Task Force, and they even have an acronym. It's going to be called ART, MAV ART. Isn't that something? ART, MAV ART. It's an anti-racist task force, they have goals and objectives, and it's all about we Muslims living up to say who we are, that we stand for justice. And so I think it's very important that we learn about different racist problems that are out large, but also are inside our community. And if we're going to fix anything, we're going to fix ourselves first. And the first one they're going to be talking about on Sunday is anti-Black racism. And there's some real stories that are true stories of injustice that you want to tune in and listen to. All right. So with that, I'm going to close out with a short dua. Bismillah ar-Rahman ar-Rahim. Oh Allah, we seek your protection from anxiety and grief. We seek your protection from lack of strength and laziness. We seek your protection from being cowards and being stingy. We seek your protection from being overpowered by debt and the oppression of men. Suffice thou with us what you permit, and keep us from what you do not permit, and make us free from want of anything besides you. And Almighty God Allah, please heal us. Please heal us physically. Please heal us mentally. Please heal us spiritually. Amen. Thank you.
Ameen to these beautiful prayers, Sister Talibah. Thank you so much, Sister Talibah. Thank you so much, Dr. Tayyab. Thank you so much, Dr. Hina Khan. And it's always a pleasure to have you, Dr. Hina, Dr. Tayyab. Thank you so much for your time. Inshallah, I hope to have you in our sessions in the future. Until next time, everyone, stay safe, stay positive, take care of yourselves and take care of others around you. And inshallah, we hope to see you again next time. Assalamu alaikum.
Assalamu alaikum.
Assalamu alaikum.
Wa alaikum assalam.